Hi, all of us have experienced difficult toddlers. And as a parent, when you're out and about, you see a parent trying to strap their child in the back of a car seat and struggle. And all of us know and have experienced that similar problem. Or in being in a shopping center, because kids know when you're out and about that you're vulnerable and they have these meltdowns. So why do they occur? Tantrums usually begin in children from the age of 1 year to about 18 months. And they get worse between the ages of 2 and 3. And then they decrease and almost disappear at the age of 4. It really occurs thereafter. Being tired, hungry, sick, or unwell certainly adds a lot of frequency to these problems. So why do children have these temper tantrums? From the day a child's born, their job is to separate from you. And they've got to do that by separating. And they're going to try strategies. They're going to try anything that works. So think about that. If they get away with it, if you let them get their way often enough, they realize that's a great strategy. They're going to continue with that. It's like throwing spaghetti up on the wall, see what sticks. Just think about a gambler who goes to a casino and wins once over 6 months. And that's enough kind of stimulus and enough encouragement to keep coming back. So a child needs to know that there is consistency. There are times when they sleep, when they kind of get up in the morning, and when they eat, and they kind of need to know that parents are going to be consistent. Children do not what you say, but they do what you do. So you can talk, talk, talk until you're blue in the face. But what they're going to do is the way you act. So you've got to keep calm. You've got to kind of remain as regulated as you can, because that's the way they're going to react. They need to see an adult or a parent that's in control. So make sure that your child eats, sleeps at the usual times. If your child needs a longer nap at that age, let them have it. Some kids need this. 20 minutes, rest, reading a little story, they rebooted and they're ready to go. Other methods to prevent tantrums, these including, you need to talk in a tone that sometimes, contrary to the way you feel, is more kind of moderate and controlled. Just think about when you deal with people, the supervisors or bosses that you've had, when they remain in control, it gives you a lot of calmness. Toddlers live in the moment. They want things done now, immediate gratification. And what they kind of have difficulty in is delaying that gratification. And that's normal part of self-regulation and learning. So at what point does a problem with just being a normal toddler, learning to self-regulate, when does it cross over the line and become a problem? Remember, a child needs to know the boundaries. You need to set the ground rules. You can't prosecute somebody who doesn't know the rules. You've got to be on the same page as parents. But when children have other problems, like they have difficulty maybe with behavior problems, maybe those runs in the family. A child, when does it become too much of a problem? When is there a problem with almost like oppositional defiance? When does a child's behavior kind of step over the market and you need to get help? If the tantrums get worse and you do not think that you can manage these, seek advice, because these are things that you need to intervene early. It can be disruptive and cause a massive problem with your family. If you feel that you're getting angry, you're shouting and you want to hit your child, that's a problem, because you're going to really become dysregulated, and that is not a good strategy, because children, remember, are going to do what you do, not what you say. So if the tantrums get worse after the age of 4, your child injures themselves, destroys property during tantrums, Your child's got other developmental problems, delayed speech. Your child holds their breath, and particularly if they faint, called breath holding episodes. Does your child also have nightmares and night terrors, toilet training difficulties, stomach aches, headaches, anxiety, refuses to eat and clings? These are signs that there are other problems. Remember, if you worry, get help. This is something that I deal with for a living, and these are things that I can give you the right advice and give you some pointers and to look out for other conditions. You know, remember this final little kind of nugget of information. A child that's busy, impulsive, active, they can't stop. Even girls can be very busy, not just boys. Remember, being impulsive, busy, and hyperactive goes together with an impulsive, busy, emotional state. Not controlling their behavior goes together with not controlling their emotions. So they're unable to control emotions and unable to kind of in the moment adapt like other children. So if these are problems that you are worried about, please let us know.